Hello and welcome to this very special live Q&A hosted by Scroll. My name is Karnika Kohli. We have been dealing with the coronavirus pandemic for almost half a year. And for the last 4 months, the world has been in some sort of lockdown at different levels. So far, over 16,000 people have lost their lives in India, and close to 500,000 lives have been lost all across the world. Today, to discuss the pandemic and its aftermath and how we as a society are dealing with it, we have Dr. Alok Sarin. He's a psychiatrist based out of Delhi. Hello, Dr. Sarin.
Good evening.
How are you doing?
Thank you.
So the coronavirus pandemic has affected people all across the board, right? Like it's not just like the poor getting affected or anything. People from all classes are affected from this. So some are stressed about their financials. Some are stressed, like some have to worry about how to get groceries on a daily basis, and a lot of people have been dislocated, especially in India. Migrant labor. Every day we read stories about people walking hundreds and hundreds of kilometers just to reach home to be safe. But this isn't the first pandemic that the human race has had to deal with. How have the pandemics in the past shaped our society? And do you see any parallel when it comes to COVID-19 and its aftermath?
Yeah. So the way to perhaps understand this is that this isn't, as you said, the first pandemic. It's certainly not the last pandemic. It is. It's not the first time that disaster has struck. In fact, as you said, it has affected different people in different ways. The defining image of the pandemic, at least in India, I think is going to be that of the migrant worker walking hundreds of kilometers across the length and breadth of the country. And if we stop for a moment and think about this, the last time that something like this in a scale of this nature happened was during the partition. So it's not just pandemic. This is it's dealing with social upheaval. It's dealing with disaster. It's dealing with difficult social situations, because I think what we must understand is that a large part of what we are dealing with is the pandemic, and a large part of what we are dealing with is, in a sense, dealing with the pandemic. The the interventions in themselves have had an afterlife, and that is perhaps something that I think we need to be clear about and understand, because the impact of that on lives is something that we will have to try and figure out. So as a mental health professional and as somebody who's interested in the history of psychiatry and the history of medicine, I and a colleague of mine, Dr. Sanjeev Jain from NIMHANS, the National Institute of Mental Health and Neurosciences in Bangalore, have put together a very short presentation, a few slides, which, if you could put them on, maybe we can just go through that. And what we try and do is to try and understand this. So can I have the first slide, Karnika, of the presentation? Thank you. So thank you very much. Can I have the next one? Yeah. So as I said, this is put together by Dr. Sanjeev Jain and myself. So one of the learnings of the pandemic, or one of the learnings from history, is the learnings from the what actually is called the Spanish flu of 1918. But it's quite interesting that the reason it is called the Spanish flu is because Spain was one of the few countries to report it. Spain certainly wasn't the worst hit. And many people believe that it is more properly called the Bombay influenza because India is the country where it was the worst hit. About 11 million people died in India in the flu epidemic, in the flu pandemic uh, in 1918. Like the current scenario, the uh, contagion came from outside. It was uh, at the end of at the end of the First World War, and from there it came to Bombay, and from there it spread across the country. Can I have the next slide, please, Karnika? Thank you. And like all disasters, like all social upheavals, the impact of disaster and social upheaval is very different depending on uh, who is more vulnerable. Uh, like in all disasters, the the more disadvantaged bear the greater brunt of uh, the the disaster. This is a small slide from the Indian Medical Gazette. I'm sorry, I think the date 1923. Yeah, it is 1923. This is deaths per 100,000 people. Amongst the Europeans, the Parsis, the Eurasians, and the Jews, the figures are around 9 or 10. Amongst what is called the low caste Hindus, the death rates per 100,000 is an astonishing 61.6. Can I have the next one, please? There are some very interesting observations that are also made at this time. Like in the present scenario, civil society actually steps up, of course, in various ways and in different manners. And a little note in the Indian Medical Gazette in 1918 says that the public health conscience is a plant of very tender growth, though it must be acknowledged that never before, perhaps in the history of India, have the educated and more fortunately placed members of the community come forward in such large numbers to help their poorer brethren in times of distress. Can I have the next one, please? So, this is a rather busy slide. I'm not sure that you can see it, but the density of the color is the on the map on the left is an indication of uh, density of spread of contagion. The virus spreads. It comes to Bombay and it spreads along the railway tracks, going to central India, going across the heartland, Mumbai and Delhi, the central provinces, and then spreading across to what is the western part of India along the railway tracks is how it spreads in the year 1918. Um, Again, the parallels with the present pandemic are not very difficult to see. This is also the 1 year in the census where the population growth is impacted. It is the one decade in the 20th century that India did not have the population, that a rise in population. Around 11 million people, by conservative figures, died during this. Can I have the next one, please? This is a very interesting little slide, an excerpt from an editorial written in 1923. It talks about how Indians of all classes rendered such splendid service in an unprecedented manner. It says that the poor of Bombay it says that the distressing conditions under which the poor of Bombay continue to exist, it may be that the Bombay may have in store for her a brighter history in the future than she has known in the past. In whatever hands her future destinies may lie, let us hope that the lessons of 1918, so hardly learnt, will not be easily forgotten. I'm not sure that those lessons have actually been learnt, or whether those lessons were hardly learnt is something that still remains uh, intriguingly mysterious. Can we have the next one, please? So, one is the trying to learn from history, trying to learn from what earlier pandemics or earlier disasters have taught us. And the two things that we learn are, one, that this is I mean, it may be unparalleled in scale, but the parallels of what happens to the vulnerable, and not only to the vulnerable, to everyone, uh, in terms of what it does to economics, what it does to livelihood, what it does to uh, the way that people deal with uh, the distress associated with the pandemic. This is a small excerpt from a paper that is still in press. Uh, and you must remember that what is called social distancing is actually the very antithesis of all that is considered therapeutic in mental health. Now, for a virus that has no treatment, that has no vaccination, at least till now, uh, the preventive health measures, social distancing, the maintenance of hygiene, are the only ways that we have of controlling the spread of the virus. Social distancing, however, as I said, is the very antithesis of everything that is therapeutic in mental health. Enforced isolation deprives human beings of social contact, and the impact that this will have on everybody is something that we are still trying to make sense of. What it has on what is called the, the so-called normal, you, me, everybody else, and the effect that it has on people with vulnerabilities, the people uh, with mental illness, is a very, very different thing, and that in itself is is going to have a is going to create in itself another pandemic, a pandemic of emotional distress, a parallel pandemic, which is something that I think that we will need to be aware of and deal with. Can I have the next one, please? It's a very large subject. It has produced an astonishing amount of outpouring of writing in in academic journals, in the in print journals, in online portals, in social media, in public discourse. We must remember that the impact of uh, the influenza uh, virus in long-term consequences of psychiatric illness is something that is still being debated. What impact COVID is going to have on future presentations of a neuropsychiatric illness is again something that we will have to wait and see. Can I have the next one, please? Uh, the other interesting thing that has happened is the effect of the penetration of science. Uh, and again, this is a very interesting thing that today we know very much more about the virus, about this specific coronavirus. We know we know an immense amount more than we did uh, a few months ago. A few months ago, we knew nothing about it. But today we know a very large amount about this virus. But what we don't know is, is how to prevent it and how to treat the very severe manifestation of it. Even that we are learning about slowly. But the way that science progresses, the way that science develops, is in small incremental ways, in building up hypotheses, in questioning those hypotheses, in proving or disproving those hypotheses, and then making our understandings broader and deeper. Unfortunately, what the pandemic or what scenarios of today demand is more immediate answers. And this is not the way science works. That is the way that magic works. And we're actually looking for magic, the answers of magic in science, which is why we are, in a sense, turning to magic very much. Uh, the way that science works and making science accessible and available in public discourse is something that I think that we'll have to think about and get back to. Can I have the next one, please? So the learnings about of public health. Public health has to keep in mind both preventive and social medicine. Uh, it's not just the biological, it's not just biotechnology. It is that the maintenance of sanitation, the maintenance of social distancing, difficult though it might be, is as important today as the biotech, as it were, of medicine. What we have to learn is that public health response has to look beyond just public health. Public health response has to look also at the social aspects, has to look at the question of livelihood, has to look at the question of displacement, has to look at what is happening to the individual. If public health focuses only on the health, the medical health aspect of it, then there is going to be a huge fallout. Public health has to be inclusive. If public health looks only at the privileged, it's going to be hugely problematic. And that is what we have to learn. Our thinking, therefore, has to be much larger. And those, I think, are the learnings that we have from both history and the mental health aspects.
Have you seen, like, is there like a difference in how people process, like, in and pandemic, or like a one-off incident or something like a disaster that is, man-made? For example, like how we process like a 26/11 or a 9/11 versus how you'd process like living through a pandemic.
Yes. So disasters, in a sense, or difficult, why disasters? Difficult situations will reshape our understandings of our worlds, the way that we look at it. So disaster, in a sense, takes fault lines, existing fault lines, and those fault lines can be individual psychological, the fault lines can be vulnerabilities, the fault lines can be communal, can be religious, can be economic. It will deepen and broaden those fault lines. So a disaster with a clear blame situation, with a clear culpability, engenders both a response in the way that I respond and in the way that communities come together. So it is a gathering of communities against an objectivized other.
Hmm.
With the virus, there is no clear other. The other is invisible. The other is is mystified. The there is a lot of work on previous pandemics and the making of religion, the making of religious icon uh, in the shape and the name of the pandemic. There are temples. There are temples in the south for the plague. There are there is a linking of the smallpox to divinity. So it is both an attempt at the making of meaning, of rendering the ineffable understandable, and the way that we deal with it. And at the same time, what it does is as I said, deepen those fault lines. So it creates an othering, and that othering can be communal. We have seen it happen in our country. We have seen it happen across the world. This is the Chinese virus. It's pretty much everywhere because human beings need or think that they need somebody to blame. And given the fact that those anxieties are are the norm, and those anxieties are pretty much prevalent everywhere, uh, that process of the deepening, widening of those fault lines makes it that much more difficult to deal with. And social inequity makes it very, very much more worse.
What kind of role do you think effective or ineffective leadership plays at times like these? Because you mentioned fault lines that already exist, right? And right now also the country, I mean, especially in Indian context, the country was pretty much divided before this also. So what kind of role do you think this will play, and like how I think I'm trying to ask is, like, for someone who actually finds comfort in the leadership, would dealing with this pandemic be different for them compared to someone who didn't have much faith in the current leadership, and how they see this pandemic and going forward?
So it's a complex question, and the answer to that is that, look, the anxieties are universal, and the anxieties about what this does uh, to both in terms of health, in terms of contagion, the spread of contagion, what this does in terms of economic impact, what it does in terms of effect on livelihood. Those anxieties are everywhere. The leadership is not going to be immune to those anxieties uh, in any way, like the population is not immune to those anxieties. And the impact of the virus and the impact of the displacement, the impact of the economic, the brunt that is borne, will all layer themselves on one another. Uh, and in many ways, if I don't trust the leadership, the anxiety will be much higher. One could argue that the reason that so many people across the length and breadth of the country got up and walked away back home, to a, a mythical past, because they came from those villages. The reason that they came from those villages is because uh, of the hope of economic improvement, of the fact that the villages did not have enough to sustain them. The reason that they went back was because they didn't believe that the urban environment could or would support them.
Hmm.
So it is actually a lack of trust. In many ways, it is as much a loss of livelihood, it is a fear of contagion, it is a lack of trust. Uh, and this makes that impact worse. It would be simple to say that that in times of difficulty we need to trust, uh, but it's not necessarily a button that anybody can push, and which will make that happen. Uh, the impact, the medical impact of the virus is huge. As you said, thousands have died in India, many hundreds of thousands have died across the world. The social impact, the economic impacts, the impacts on the fabric of society is actually going to be much larger.
Hmm.
And in the ways that you know that it then lingers from one generation to another, uh, is something that we are all going to have to actively think about. The other thing that happens is that with the with the pandemic, as with any disaster, as with any anxiety, if I may, the urge is to think small. The urge is to protect myself. The urge is uh, to lock down, to to protect, shelter myself, my family members, or if larger, my the people in my street, in my colony, in my state. The fact of the matter is that this is contagion. It has come from outside, and unless I'm able to think larger, thinking small is what the disaster is propelling me to do. Unless I'm actually able to step out of that anxiety of thinking small, which doesn't mean that I should unlock down, which doesn't mean that I should, start partying today. Because very often the argument is that if not lockdown, then what?
Hmm.
If not lockdown does not mean that there is no middle ground of maintaining that social distancing, or what the best ways. And unfortunately, in a in in a world, or in the world of today, nobody has the answer to this. Nobody knows which is the best way. but
Hmm.
but thinking, as I said, in terms not that health problems or public health needs an awareness of social health as much as it does of health, which is why public health historically has been in medical colleges has been that most reviled of departments, preventive and social medicine. And in many ways, that social bit of medicine has been pushed so far back into the background that it has uh, it has ceased uh, to engage us. And I think we need to bring it back. We need to bring it back to the foreground.
You mentioned dealing with this for generations, and that sort of brings me to this question about collective memory. When I was researching for this chat, and I came across a bunch of reports and like some psychologists saying how the brain, when it's sort of like under attack, and when it's like there's so much anxiety, it tends to repress certain memories. And some even suggested that some of us would have to deal with short-term amnesia after we're done with this, and our brains would sort of create fake memories, the things that didn't really happen. So what I want to understand, and I know there's like no definitive answer to this, because we will have to gradually see how we deal with this and what happens. I mean, the lockdown could also have long-term implications, right? The unprecedented situation we now find ourselves in inevitable, and it will be recounted again and again once it is over. How do you think we will remember time, and the time that we have spent in a lockdown in, like, let's say 5 years or 10 years or like 50 years?
Honestly, I don't know the answer to that. That is something that only the future is going to answer. Uh, it is probably the most extraordinary time of our lives. Why probably? It is definitely the most extraordinary time of our lives. And and the way that we construct memories of this in the future will depend on where the vantage points that we are looking from. And the memories could be horrific. The memories could be spectacular. And the fact is that all of these will be true. There will be many, many tellings of this tale as there are of, of even the most ordinary and prosaic of events. And this is hardly either ordinary or prosaic. So, for
Touche.
years, for generations, stories, poems, songs, novels will be written about these times. And they will be both, and there will be multiple hues of colors.
Hmm.
Uh, some will be brilliant, some will be brilliant of that wonderful time that I spent in learning how to bake, or that wonderful time where I spent all my time writing.
Hmm.
Or it could be this dark cloud covering the horizon. And the fact is, they will all be true. They'll all be true for different people.
Um, so, what kind of institutional support should we have for frontline workers? And not just like essential workers, but also like journalists who are covering the pandemic, and they are out every day putting their lives at risk to deal with and process with the pandemic and the associated trauma. Because we have seen, like, especially in Delhi, when the reporters were reporting, Delhi journalists were reporting on the riots, a lot of them talked about dealing with the associated trauma that comes with reporting on these kind of situations. And a pandemic is worse, and it's going to be really prolonged. So, what kind of institutional support do you think should be there?
Acknowledgement of the difficulty, conversations around those difficulties. And so again, it can't be it can't be a formulaic answer. It doesn't exist. But an awareness of both the nature of the difficulty and the understanding of the need of that human connectedness. So
Hmm.
the understanding that social distancing or physical distancing uh, does not or should not necessarily mean uh, a lack of compassion or a lack of social connectedness. So an acknowledgement, as I said, of this and of working towards
Hmm.
building those channels of communication. And this is the essence of all therapy, is of sitting down with somebody and talking about it, and the process of meaning making, of working towards an understanding. How I am to do this, the 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 tools which I use, uh, whether I nominate these 5 people to do this, or whether I have a committee to do this, or I do a debrief, is detailed. But both the awareness of the need, putting it on the table, an acknowledgement of the need and an acknowledgement of the need to build in a process, is, I think, where we need to start. And
Uh,
for healthcare workers, for policemen, for journalists, for people who volunteer to help, and that is very large number, a very large number of people who have actually stepped out of the comfort of their homes to help, because that, as I said, is going to be the enduring memory of the pandemic. The migrants walking across the country,
Hmm.
and the amount of people who have actually stepped out and helped them, and what it has done. And it's been empowering and devastating at the same time.
Hmm. So, with the rise of people reaching out for support and the need to provide care and attention increasing at home, how do you envision such people? I mean, it can be your family, it can be good friends who are out there, can invest their energies effectively without compromising on their own mental health.
So, in many ways, reaching out to help people is very rarely compromising of mental health. It can be exhausting. It can be uh, fatiguing. It's very rarely compromising. I may be completely drained at the end of it, and I may need to talk to deal with it. I may need to make sense of it. But if I do this, if I reach out to help others, I do it as much for myself as it is for others, and the fact that it will help both me and the person whom I'm intending to help. In that sense, the an awareness of the interconnectedness of the world. When we very often we think of of doing this as charity or altruism, and
Hmm.
as something that that I do as a favor to others.
Hmm.
uh, I, I think maybe we need to look differently at that. I think we need to look at it more as I'm as doing it for oneself, rather than, because I am as much part of the larger world as
Hmm.
as the recipient. And unless I understand that uh, uh, things will not change, and therefore putting that social back uh, into the practice of not just medicine but of society is perhaps what we need to think about.
Um, So while suicide has been a subject of conversation on mental health, and we have seen a spike in coronavirus-related suicides in the past. And one of the stories, it's a very small research, but I found a story on the Economic Times where 300 cases were analyzed, and they were either people had committed suicide because of the fear that they will get infected or they will infect others. And then obviously there's migrant labor who's losing, who dying on the way going back home, and something similar. So the pandemic has brought about a new dimension, right? The trauma triggered by the isolation, like you also mentioned, like it's the complete opposite of what you need when you are feeling anxious, or losses suffered during this phase have driven some people to take their own lives, right? How do we respond to this? What are some of the signs that we can watch out for and ensure that we're there for each other?
Suicide is an extremely complex thing. There's rarely one single or simple reason. So it is it is almost always a multiplicity of causes. It's almost always many factors which come together at one point of time. Uh, whether it is economics, whether it is the isolation, whether it is the presence of a psychiatric illness like depression, whether it is um, interpersonal factors, all of, and perhaps the in many people, it is almost always a mixture of these things. So there can be no simple answer that, if I was to do uh, these three things, or if society was to do these three or four things, then we will be able to like polio, eradicate suicide. It's not. It's not happening. You know, it is not going to happen. What can I do? At the same time, I need to understand what are the factors that lead up to it and what is it that I can do. So, both making that availability of help and support possible, of reaching out, of, as I said, social distancing does not and should not mean social disconnect.
Hmm.
If I am able to work towards that, if I am able to reach out, then there is a lot of evidence which says that I may not be able to prevent suicide, but the likelihood that I will be able to at least influence those figures is very high. And always remember that it's social inequity, uh, loss of livelihood, loss of income, economic disadvantage are very strong factors. And those are some things that support uh, certainly needs to be provided without thinking of it in terms of charity.
So we've been getting a lot of questions from our readers while we were discussing this. I think we should take some of them. So one of our readers was asked, "What are some tools or practices we can have to track and monitor our mental health better?" Very often, when asked by a psychiatrist or a psychologist or even well-wishers, we aren't clearly aware of the details of our symptoms and conditions. Um, and the next one is sort of around this only, so we'll just compile both of these. And the other one is, how can one help themselves regain focus and stay away from constant negative and demeaning thoughts?
So, in many ways, the answers are self-evident, and the answer is this: that when situation of this sort strikes, and and the fact that it is affected and upset uh, the norms and rhythms of life, it takes away from me agency. It takes away from me that that ability and power to order my life. It makes me do what situation demands. So, work routines, exercise routines, sleep, appetite routines will get disrupted. And that in itself is both unnerving and disorienting. What can I do?
Hmm.
I, as in all situations, I work to reclaim agency. That agency which has been taken away. And what this loss of agency does is creates a sense of disquiet, of uneasiness, of anxiety, of apprehension, of being adrift. And this is something that all of us will be a prey to. The more I work towards that reclamation of agency, of maintaining those routines, whether it is uh, work life routines, of exercise routines, of I may not be able to go to my gym, but if I go for a walk,
Hmm.
I may not be going to work, but if I try and maintain those routines of activity, I may not be able to go outside of my house, but within my house, if I try and re-seek, it's that whole
Hmm.
process that we were talking about of meaning making. Once I do that and I reclaim that agency, I bring that whole sense of apprehension, anxiety, dread down. And the more effectively I do it, the more effectively this will happen. Even as we say this, we understand that look, it'll happen differently for different people. People will have different amounts of resiliences. People will have different amounts of privilege. People will have different amounts of resource that is available to them. If I'm worried about, if I'm walking on the streets from New Delhi to Darbhanga in Bihar, uh, I'm not going to be worried about my exercise routine. It would be a mockery. If I am at home locked in a, let us say, in a slum, where uh, I'm worried about where food is coming from, then the lack of privilege itself is going to make all of this meaningless to me. But if I have that privilege, then these are the things that I will be trying to do to reclaim that sense of agency in my life.
Um, so before the pandemic, also we were in a bit of an economic crisis. I mean, like the scale of it depends on who you're talking to. But we did like there were massive levels of layoffs happening then and now also. I think our next question from our viewer kind of fits into that. They want to know high intelligence and chase for perfection and everything is taking a toll on mind and life eventually. How to deal with this? And now I just want to add to that. And now the economy, as like we have no idea what kind of economy we're going to inherit, and if we're going to get the jobs that we lost back and all that. So, and basically there's obviously lack of autonomy there also. Like you had certain plans for yourself and now there's just too much uncertainty. So how do you deal with something like that?
In the same way, which is which is that difficult times call for difficult measures. Of course, it is, and to be foolish and naive to think that any of these things is small.
Yeah.
Uh, and at the same time, the fact that both to the individual and to the world, uh, difficult times will come and that they will pass. And that in their passing is dependent my effort as well. So, what I make of my life
Hmm.
in big and small ways, I may have to restructure my expectation. But who is to say that that restructuring of the expectation is a diminishing of expectation? Uh, dark clouds come with silver linings. The lockdown has been terribly and horribly devastating to economy. However, as I sit here, I can hear birds chirping, which is not what I would have heard uh, 3 months ago. Air quality indexes have improved.
Yeah.
As I rescale my understandings and expectations, are also huge opportunities of thinking afresh,
Hmm.
of looking for and finding new meanings, new goals, new aspects in both personal and societal ways. As many people have said, it's a reset button, it's a
Hmm.
pause button. What I do after the pause is in some ways at least, not in all ways, I understand it is, and it would be farcical and naive to deny the difficulty. But what I in many ways what I do is also dependent upon me. And so it is an opportunity to rethink what the way that I envisage both myself and the world. To envisage, let's start with public health. How do I envisage public health happening? 1918, 19, and the editorial was written 5 years after 1918. And what he said was, this lesson which we've learned at such great cost. Uh, let us make sense of it. I don't think we did. We have another opportunity. We may or may not. It's up to us.
Hmm. Our next question kind of like fits into what you talked about how we need to think bigger. So another viewer wants to know, keeping the long-term future in mind, what are some investments that we can make now which will build stronger social and cultural foundations and possibly will enable better institutional responses to mental health crises in the future?
So again, the answer to this cannot be formulaic. The the answer can't be that that the government should set up like it has a national disaster um, agency. It should have a pandemic prevention agency or a pandemic dealing agency. It can't be a formulaic response. The answer is exactly what I said earlier, is an acknowledgement of the need to understand the nature of that social connectedness, that interpersonal connectedness, and figure out larger ways in which we can build on those
Hmm.
and see how things that have not happened before, which we have not done earlier, we we try and make sure that we will. One way of looking at it is that this is not the first disaster that has happened. It has never happened, it, and those learnings have not happened, so they're unlikely to happen. Uh, the other way is that this is an opportunity. Can I learn from it? Can society learn from it?
Hmm.
And society, while society goes through cycles, society is also evolving in many ways. And so,
Hmm.
yes, society can learn from this. Systems can learn from this. Uh, Institutions can learn from this. And it is up to us to try and make sure that, that those learnings uh, are stay for longer. Yeah.
You talked about privilege and how, like, I mean, this affects everyone, but our anxieties are very different. Mohammed Tariq wants to know, how does one deal with the understanding that most of the lives that we lost during the pandemic, starvation, and because of people had to walk back home, these are all preventable deaths. If only we cared a little bit more. How does one come to accept this, and how do we go on, move on forward?
It's a very difficult question. It is when we think in terms of public health response in narrow terms, then disaster of this nature strikes. Because when we think in terms of public health response, only in terms of public health, when we forget about the individuality of the people, that things like this will happen. And there is no way, there is absolutely no way that uh, that this should or things like this should happen. It is indefensible. The only hope or the only thing I can say is that if I can talk about these things today, and if I can hope that public health response uh, will reach out to in its in its response to the least privileged rather than the most privileged, then that is what public health uh, is intended for. And if I can make those changes, or if I can begin to start thinking about those changes, then perhaps something will happen.
Okay. We're almost out of time. So I just want to ask you if you have any last thoughts on this. And we are getting a lot more questions, but we will send them to you separately so that you can answer them individually and we'll get back to our readers. But do you have any final thoughts on this topic?
So my final thoughts are these: that look, as I said, in many ways, as I said, this is the most extraordinarily uh, strange times that all of us are living through. And what we make of this and where we take these narratives and stories forward actually depends upon us. And I think it is incumbent upon us, as both as individuals and as a society, uh, to see that, that this opportunity is not lost. Uh, we've paid a huge cost for this. We cannot afford these opportunities. We cannot afford losing these opportunities. And in many ways, if that thinking as an individual and the thinking as a society is at cross purposes, then I need to question those.
Thanks a lot for joining us today, Dr. Sarin. I think the session has been really helpful. And thank you so much for spending an hour with us and enlightening us.
Thank you.
I'd like to thank our viewers also for joining. And just go to Scroll.in. This chat will be up on our website by end of the day, and you can watch it there. You can share it there, and you can share it with people who you feel would find it helpful. Thanks a lot for joining us today.
Thank you.